Well, it is my privilege to sit down with Marianne La Croce, whose dedication here at Blythedale is unmatched. She shaped so many lives of patients and families here over her 40 years here at Blythedale. And after 40 years, Dr. La Croce is retiring. What a bittersweet moment.
Thank you. Thank you so much. It truly is a bittersweet moment. I have been so blessed to be here at Blythedale Children's Hospital for the many decades and to be a psychologist working very closely with all ages of children, from infants, preschoolers, school-age children, as well as their families, and giving my very best clinical skills and expertise to truly help them to make gains, make progress, and to really have a productive, successful life has been my goal.
Well, we certainly are looking forward to hearing more about your experience here at Blythedale and your journey and those insights as a clinical psychologist. So thank you, Dr. La Croce. Take us back several decades ago. What brought you to Blythedale?
When I was in my graduate training program at St. John's University, I was in the a graduate assistant, and I was getting ready to do my internship, which would be for a year in a pediatric setting. And there was a list in the office, and Blythedale was on the list. And when I saw it, Blythedale was my very first choice. I wanted to work with children, and I wanted to work in a hospital setting. And so I came for an interview, and the director of psychology accepted me for the internship program. And I had my training here for that year. And when I completed my training, I left to go to a preschool facility in White Plains, but also where children were receiving rehabilitation. And I was there for about 6 months, and the director of psychology at Blythedale called me and asked if I wanted to come back to Blythedale. One of the psychologists had left, and there was a full-time position. And I said, yes, definitely, I am coming back. And I came back and I stayed.
I love that. That's wonderful. And looking back over your 40-year career here, how has our understanding of infant and preschool development changed, and what shifts have most influenced your clinical practice?
When I began, it was at the very beginning of when early intervention program, this is a federal national program for infants and preschoolers from birth to age 3, it was just getting passed the law by Congress at that time in 1986. And it was brand new, and it became here in New York in 1993. I was already here at Blythedale, and Blythedale contracted. They had contracts for these infants and preschoolers to come as outpatients to Blythedale, and they required a psychological evaluation, and I did all of the psychological evaluations on all of the early intervention babies and preschoolers that came to Blythedale as an outpatient. And it was so exciting to really get in on the ground floor and really be able to do preventive intervention, recognize their strengths and their weaknesses, what services that they would need, and it was interdisciplinary. It was also done in conjunction maybe with a speech therapist or an occupational therapist, physical therapist, and together we prepared our reports, submitted them to early intervention, and they had a family meeting, and then the child could begin to start to receive services at a very young age. While their brain, we call it plasticity, in terms of being able to compensate, where their well-developed and strengths are able to take over for areas of the brain that are weaker. And that was very exciting. And also at the same time, through the Individuals with Disability Education Act, they also approved for CPSE, Committee on Preschool Special Education, to now go for children aged 3 to 5. Before it was just 5 through high school. And I was here for that too, and did all of the CPSE outpatient psychological evaluations as Blythedale contracted with the school districts.
It's such a critical time for those children as they begin their development, and you had a part in that.
Exactly.
Wow.
These were brand new programs at the time. Yeah. And I was right here ready to see them.
Now, in your experience, I know this is going to be hard to answer, but what moments would you say stand out as the most meaningful or rewarding?
The most meaningful and rewarding is seeing the children make progress and really benefit from the intervention that they receive here at Blythedale. And they become so much more functional, more independent. They have more success in school. We've seen children start as inpatients, and then they go on to our day hospital program. They get discharged home, so they get the best of both worlds with their families, and or coming here for school and receiving therapies at a very intensive frequency. And then eventually they actually graduate and go on to college, many of them. And that has been so rewarding. And I also find very rewarding my work on the infant unit with the moms. We are so much more aware now of postpartum depression and the importance of this with moms the first year of life, first 2 years of life with a baby. And they never imagined, they never expected the trauma and the shock of having a baby born prematurely or with a medical complex condition and having to be in the hospital. Some with tracheostomies, with ventilators, with gastrostomy tubes. And if a mom is having postpartum depression, it doesn't go away on its own. It needs treatment. And it impacts the baby's emotional and psychological well-being, because that interaction of the baby and the mom is so crucial early on. So I, as the psychologist, work with the moms, and I get to do the screening. I have them talk to me, they trust me, and together we make the phone call for a referral for mental health. And that has been so rewarding for me.
And it's so important, right? Because we know that when the mom is happy and feeling good about herself, then she can care for her baby in the best way.
Exactly.
And again, another thing that you've had a part in, so that certainly is extremely rewarding.
Yes.
What has it meant to you personally to be a part of this early journey and to have such a meaningful part of these families' early journeys of life?
It has been very meaningful to really be able to intervene early, because the research shows that adverse childhood experiences from early on have a huge impact later on in life. It's lifelong. And it really, if it goes on without treatment, and it results in health problems for the adults, and also it shortens their lifespan, premature death. So it's very significant. And personally, to be able to work with the very young infants and families and children and be able to put them on a trajectory in a more positive direction, and really to prevent some of the suffering and some of the frustration and some of the trauma means everything, because it results in their lifelong productivity, success, and having a longer life, a healthier life, their well-being.
Can you share an example or examples of a case that has deeply shaped your approach to treating learning development challenges in early childhood?
I had the privilege of working with conjoined twins. They were admitted to Blythedale Children's Hospital when they were 18 months of age. And the conjoined twins were joined at the top of their heads when they came here, and they were referred from Montefiore Children's Hospital. And they were being cared for by Dr. Goodrich, very well-known neurosurgeon. And his plan was to have the twins be here at Blythedale, receiving all the medical and interdisciplinary rehabilitative care, and to eventually be able to separate them. And this was very new research. And he started, I remember, by having skin expanders. And it was to stretch their skin gradually to be able to cover the area of the surgery. And again, it was at the top of their heads where the nerves and the blood vessels were intertwined. And I remember being in awe of watching and observing the twins in the therapy village with the physical therapist, one for each child. They had them on a therapy ball, and they slowly moved the ball side to side to do the exercises with them. Feeding was a great challenge because they were not able to sit upright. So to have nutrition, adequate nutrition, was also very challenging. I worked very closely with the conjoined twins to do the psychological testing that they needed before they had the surgery. The surgery that Dr. Goodrich did to separate them was very successful. And then I also did the psychological testing after the surgery to prepare for them to attend public school in their community and eventually to be able to leave Blythedale and be at home. I worked closely with them also through play therapy to prepare them. I had to think out of the box. This was not an example that would be in the textbooks. So I had to be creative. I was able to get 2 very soft little teddy bears with Velcro at the top of their head, and I worked with them and showed them that they were able to separate and put them back and separate and put them back, while I spoke to them about how much more fun it will be when they're separated to be able to see each other, to be able to play together, to be able to walk, and to be able to enjoy life together. Twins, it was a fascinating case because twins are so close, yet they have their own personalities, very different personalities, and to develop their sense of self after the separation. It was a great success.
You gave them that hope and almost that excitement as they entered a different chapter in their lives.
Yeah.
It's so exciting. And you probably learned a lot from that experience as well.
I truly did. That it was a real learning experience for me as we went along, and just how to come up with approaches that would work for them.
So fascinating. We know that your experience spans over several years, and certainly misconceptions have changed throughout the years. But I'm curious to hear from you what you believe are some of those common misconceptions about learning disabilities in young children, and how can clinicians and educators better address this?
Okay. So learning disabilities with young children, we say, what is a learning disability? A learning disability is children of average and normal intelligence and above average. They have definite strengths in many areas, but there may be one area, let's say maybe like reading or math or writing, maybe 1 or 2 areas that are weaker than their other strengths. And these are children that, because they're bright and they're intelligent and they can do so many things, then the misconception is when they get to school and if they're struggling, they may be perceived, or misperceived, I should say, as lazy, that they're really not trying. They could do it only if they tried. And that is not true. It's just the opposite. They are trying so hard, but unless you do the psychological testing and uncover where the weakness lies, only then can you begin to remediate the deficit and help them to compensate. Use their strengths, teach them in a certain way to compensate, and they can begin to read. So that's one misconception. Also, the child with the learning disability may be the child who's misbehaving or seen as misbehaving because they're frustrated. And that's their way of communicating, that they know that it's hard for them to compete with the other children, and though it gets expressed, their upsetment in that way. Or they may be perceived as not intelligent when that's not the case. Einstein, he was so intelligent, he didn't read till he was 7. He was considered to have a learning disability. And these are children that we do not want to leave back in kindergarten or 1st grade. It's not a maturation issue. They really need to be tested by the psychologist and then remediation provided to really help them.
Give them the help that they deserve.
Exactly, exactly.
Please share some lessons that you've learned from the children that you've worked with here at Blythedale that you'll carry on with you beyond your professional life.
Yes, I've learned many lessons from the children, that they are always listening, and they understand more than we think. So I always say, be careful what you say at the bedside, because you're talking to the child as well, not just the parent.
It's true. It's great advice. I think we could all learn something about that, right?
Yeah. Another lesson also, it takes time. When a child has a trauma, that we want to sometimes rush in and fix it, but it takes time. It may not be till maybe 6 months, even after the trauma, that they're able to even talk about it, and the healing process can take place. So having patience, and always smile when you work with a child, because they're looking at our faces, and speak gently. that really helps them a lot to trust and to feel comfortable. And one other lesson, that they're very accepting. They accept all situations and others. They have a lot of patience. And verbal children and nonverbal children are always communicating in so many different ways, even nonverbally.
They all have a voice in
They
some way.
do. They
And you've
do.
given them that voice, which is so beautiful.
Thank you.
And as you reflect on your career, what advice would you give to your colleagues, including some early career psychologists who will continue this important work?
My advice to other psychologists is to take your time, do a psychological evaluation, get to know the whole child, their strengths intellectually, academically, emotionally, and also to work with the child together with the family. It's relational, and you cannot separate them. That I always say that to the parents, we work as co-therapists. I can tell you what I feel will help, but you are with them for all the other hours. So we work together, and that's how we can have the most success.
That's wonderful. Is there anything else that you would like to add?
Blythedale is an amazing hospital. This is the hospital where miracles happen. And I say to please continue all the good work that is here. I know you will. And it's really a mission, and it's a vocation. It's not just a job.
Well, thank you so much, Dr. La Croce, for your time. Thank you to your dedication and your service here at Blythedale. Certainly a bittersweet moment for everyone here at Blythedale, but a lot of good lessons that we've learned from you, and we wish you the best of luck as you enter this next chapter in your life.
Thank you so much. I truly appreciate it. It's been a great blessing. Thank you so much. Thank you.